endotracheal tube is a catheter that is inserted into the trachea for the primary purpose of establishing and maintaining a patent airway and to ensure the adequate exchange of oxygen and carbon dioxide. Wire tube inserted. 1. Airway protection, management. 2. Ventilation and oxygenation. 3. Anesthesia administration. 4. Facilitating bronchoscopy or surgery. ETT insertion is typically performed by experienced healthcare professionals including anesthesiologists, critical care specialists, or trained nurses. Endotracheal tube insertion guidelines. 1. Preparation. Gather all the necessary equipment, including the appropriate sized ETT, laryngoscope, stylet, syringe, cuff, securing devices, and suction equipment. Ensure that the patient is in a suitable position, such as the sniffing position, which aligns the oral, pharyngeal, and laryngeal axes. Pre-oxygenate the patient adequately to optimize oxygenation before intubation. 2. Induction and paralysis. Administer appropriate anesthesia and muscle relaxants to facilitate intubation. Continuously monitor the patient's vital signs, including blood pressure, heart rate, and oxygen saturation. 3. Laryngoscopy and intubation. Use a laryngoscope to visualize the vocal cords. Insert the ETT through the vocal cords into the trachea. Confirm proper tube placement by observing bilateral chest rise, auscultating breath sounds over both lung fields, and verifying carbon dioxide waveform, capnography, or colorimetric detection. 4. Cuff inflation and securing. Inflate the cuff of the ETT to create a seal and prevent aspiration or air leakage. Ensure cuff pressure is within recommended limits. Secure the ETT in place using adhesive tape or tube holders. Verify that the tube is properly positioned and not at risk of dislodgement. 5. Confirmation of placement. Perform a chest X-ray to confirm the final ETT placement, especially for critical care patients or if there is any uncertainty about tube position. 6. Post-insertion care. Continuously monitor the patient's vital signs, oxygenation, and ventilation. Maintain proper ETT positioning and patency. Regularly assess cuff pressure and maintain it within the recommended range. Provide appropriate sedation and analgesia to ensure patient comfort. It's important to note that endotracheal insertion is a complex procedure that requires proper training and expertise.